Suboccipital triangle. We'll see the formation of the suboccipital triangle. This black point, consider this as the posterior tubercle of the first cervical vertebra, that is the atlas vertebra. It does not have a spine, it has a small tubercle that is known as posterior tubercle. So this is the C1 posterior tubercle. C2, the axis vertebra, has a very massive bifid spine. So this inverted V-shaped bifid spine is the spine of the second cervical vertebra. This point represents the posterior tubercle of transverse process of first cervical vertebra. So third point is the posterior tubercle on, or simply the transverse process of the atlas vertebra. This large point represents the external occipital protuberance. Line drawn from the external occipital protuberance is the superior knuckle line. Below line is the inferior knuckle line. This represents the mastoid process. Now we'll see the formation of the suboccipital triangle. It is formed by four muscles: rectus capitis posterior, minor and major, superomedially, superior oblique, superolaterally, and inferiorly it is bounded by inferior oblique muscle. So this is the first muscle, rectus capitis posterior minor muscle, which arises from the spine of C1, that is the posterior tubercle of C1, and it is inserted to medial part of the inferior knuckle line and the area below it. So this is the rectus capitis posterior minor muscle. Second muscle is the rectus capitis posterior major, which arises from the bifid spine of the second cervical vertebra, axis vertebra, and it is inserted to lateral part of the inferior knuckle line and the area below it. So this is the rectus capitis posterior major. Some of the books consider only rectus capitis posterior major as the boundary of the suboccipital triangle, but we'll consider both muscles. So this is the superomedial boundary formed by rectus capitis posterior major and minor muscle, both attached to, inserted to inferior knuckle line and area below it. Now inferior boundary is formed by inferior oblique muscle, which arises from the spine of second cervical vertebra, and it is inserted to transverse process of the first cervical vertebra. So it arises from the spine of the axis vertebra and it is inserted to posterior tubercle of transverse process of the atlas vertebra, second cervical vertebra. This is the inferior oblique muscle. Inferior oblique forms the lower boundary. Now the superolateral, it is bounded by superior oblique muscle. As you can see, it arises from the transverse posterior tubercle on transverse process of first cervical vertebra, where the inferior oblique is inserted. So from the insertion of the inferior oblique, we can say superior oblique arises and it is inserted to area between the superior and inferior knuckle line, and again lateral part of the area between the superior and inferior knuckle line, superior oblique, is inserted. So this is the superior oblique muscle. So now the triangle is formed superomedially by rectus capitis posterior major, inferiorly by inferior oblique, and superolaterally by superior oblique muscle. Roof content. So this represents the third part of the vertebral artery and the first cervical nerve C1 and suboccipital venous plexus. These are the three contents of the suboccipital triangle. Now roof of the suboccipital triangle, as such, it is formed by a strong sheet of fibrous tissue. There is a strong sheet of fibrous tissue which forms the roof. Over this fibrous roof lies two muscles. Medially semispinalis capitis and laterally it is the longissimus capitis. Medially it is the semispinalis capitis, which is inserted to medial part of the area between the superior and inferior knuckle line. It overlies the medial part of the roof, and laterally the roof is overlapped by the longissimus capitis muscle, which is inserted to mastoid process deep to sternomastoid. So this is how the roof is formed: medially by semispinalis capitis, laterally by longissimus capitis.